Good afternoon, everyone. I was asked to give a short career talk to young aspirants of Conception Catholic School, and just a bit of a background before we have a good head start is just like to introduce myself. And my name is Maylene Pineda, and I'm an obstetrician and gynecologist here in Australia, with further interest or further training in diagnostic ultrasound, with high interest in high-risk pregnancies. Currently, I am a consultant obstetrician in one of the tertiary hospitals in Sydney, and we recently started our ultrasound business with other partners in the city. Back home in the Philippines, I actually finished the training program in obs and gynae, and I finished that in 2006. The Doctor of Medicine and Surgery, I graduated from the University of Santo Tomas, batch 2000, and I did the licensure exam a year after that, because you have to do 1 year of internship as your hospital immersion. The training in Philippines to be an obstetrician is 4 years. However, the training in Australia is 6 years. So overall, the training I had is a total of 10 years all up for obs and gynae, and further training with ultrasound and high-risk pregnancies. And if you think about it, it's ongoing, continuing medical education. So so that's a bit of my background. Back in secondary and primary studies, I finished my secondary education in Conception Catholic School, and I'm coming from batch 1991. So when you choose a career, I think it's really important that you know what you are passionate about. So it doesn't matter what your background is. It doesn't matter if you came from a poor family, or it doesn't matter whatever it is. If you want to be a doctor, I think you should pursue it. Before you actually go for a career in medicine, of course you need to know what are the requirements. So for you to get in the medical school in Philippines, back in my time, you need to have high marks, and for you to get high marks, of course you need to study very well. And there's what we call national medical admission test that you need to have a good mark so that you can enter a medical school. So that's one of the requirements. In Australia, they're a lot more difficult in letting people to enter the medical school, and they want you to be 0.5% in the highest marking of the state before you can enter the program. So you can either do it as an undergraduate, meaning once you finish your high school, you can go straight to medical school. Some schools in Philippines do offer that, but my understanding when I was in the University of Santo Tomas is you can be in a class called accelerated class, and that's instead of finishing your postgraduate as 4 or 6 years, in 3 years' time, after this 3 years of undergraduate studies, you can go straight to medicine. In Australia, you can go either undergraduate or postgraduate. So the default in majority of the time is a lot of people would choose science courses, because obviously medicine entails a lot of science, and you need to be good with anatomy, you need to be good with chemistry and physics. Numbers not much, but it's a science subjects. So they're science, mainly basically based on science. A lot of people would do like a default would be nursing, because say for instance, as a background, so as a background being a nurse, so if you didn't finish medicine, then at least if you finish nursing, it's one of the good job or career that has good stability regardless of where you are. Other default will be some would have a different degree, just like what happened to me. Initially, when I was a child, I really wanted to be a doctor, because I was advised by one of my uncles who is president of one of the companies. He said, oh, for you to get better in life, you need to do economics, which is what I did. But as I go along, I realized it's not what I like. So because I really wanted to be in medicine, so what I did was I tried to finish the economics, and in between I kind of searched what are the requirements to be admitted in medical school. So in between every semester, say holiday semester, I did some chemistry, physics, so that I can complete the requirements. And by the time I finished the economics, I actually have all the requirements being ticked off. So I was qualified to enter to be admitted in the medical school. So because it is my passion, it didn't stop me from pursuing this career, and it's all worth it. A lot of you probably would think like, if I didn't do the nursing, or if I am not in science, I think it's really impossible. So I've met a lot of people who were not into science, but because it's their passion, they still pursued the career in medicine. So I'm one of them as well. So I think the best thing that you can do then is reassess what you really like. And if you think that that's what you really like, there's no point of, or there will be no one who can stop you from doing what your dreams are. And if, say, plan A didn't work, what about plan B? And what about plan C? I know we will have some failures, but those failures shouldn't be stopping you from doing what you like. And these failures are the ones that can make us really strong, and we can always learn from them. So my best advice is, of course, you need to choose a career that you are really passionate about. Number two, if you're passionate about that, you should know what the requirements are. So from primary, you should aim for having good marks so that you can be admitted in any medical school in the Philippines. Okay? And number two, say if plan A didn't work, then you should have a plan B. So plan A default, as I said, is science. But if you didn't get into the science because you have a change of heart, then maybe think about, whatever you have chosen to be in college, you can either choose to finish that and then see what your future will be and try to come up with the requirements, just like what I did. And then pursue it later on. And you'll never fail. As long as you want it, you'll get it. And then plan C. Okay, if I want to be a doctor, so what will be the other avenues I can do? So maybe you can do further studies or further training in other fields, like technical studies about learning more about physics, something like that, in order to prepare yourself. So those are the other avenues that you can think of. And of course, if you wanted the career, you need to know what does it involve. Being a doctor is really hard work, because if you want to study medicine, you'll be studying a lot, and that's no question about that. And because it's your interest, it doesn't matter if I study a lot, because I like what I'm doing. It doesn't matter if I'm tired, as long as I understand, as long as I like what I'm doing, I'll pursue it. Number two, you need to do a lot of hard work. And say, even if after you finish your medicine or med school, now you would think about, okay, what kind of specialty do I like? So the reason why I fell into obstetrics and gynecology, because initially it wasn't in my head that I'll be an obstetrician, but because I got the opportunity to do a lot of surgical work, And because surgery is what I wanted to do, I was given all opportunity to enhance those skills. And true enough, I was able to enter the training program even in Philippines. And when I migrated in Australia, before you can actually enter a training program again, you'll be competing with local Australian graduates. And so because of my experience back home, and because you have to do other research studies as well, I was able to get into the program by starting from scratch. So even with my experience of 4 years, I still started from the beginning. But that doesn't matter because I like what I'm doing, and because you are also earning while you're on training, so it doesn't matter until I finish it. And then now I'm a fully qualified obstetrician in Australia. So it's all about hard work and dedication. And as I said, because it's still a continuing education, you have to really abreast yourself with the ongoing technology. Especially now we are in pandemic, so this is something quite new. So we are learning from the experience and from the studies that are done worldwide, and so that's why a lot of people come up with some vaccines that are quite good in preventing you from becoming sick or preventing you from getting the disease. And so that's why being in medicine is very fulfilling. It is also an art, so that's one of the requirements, because you need to have that good communication skills with your patients. And without good communication, you won't be able to pass that diagnosis and all the questions that your patients need to ask you about. So you need to be having that good rapport with your patients. Communication is still the key. And one last thing too, I know you're busy as a doctor, it is always good to have a good balanced lifestyle. And remember, when I say good balanced lifestyle, meaning you need to have a healthy eating habits, you exercise, and you put your family in the center, because your family is still your backbone, and making God as in the center of everything, and you won't fail. I know life is a lot of full surprises. We have ups and downs, but the main thing is we were able to conquer those adversities and learn from them. I know I have talked a lot, it's already 12 minutes, but if you have any questions or if you want advice from me regarding a medical career in Australia, please feel free to email me. Thank you and good luck to everyone.
Hi, kumusta kayong lahat? I'm Janice Soro, formerly Maria Janice de la Cruz from Batch 87. Of course, from Concepcion Catholic School, and I am very privileged that I can share with you a little bit of my career path. So, how did I become a nurse? Ang hirap ng English. So, this is my, I think, 25th or so years in nursing. I graduated nursing in BSN from St. Louis University in 1992, and then I took my boards and then my board exams, and then I started working at the National Kidney and Transplant Institute in Quezon City as a dialysis nurse initially, and then I moved on to become an operating room nurse, and I was there for 9 years. So, cut muna natin doon. So, how did I become a nurse and what made me take nursing? So, I remember nung career day namin, they invited a registered nurse from emergency hospital who inspired me to become a nurse. I forgot her name, but I am very thankful for that ate who shared her experience to us. So I learned that you don't just have to be at the bedside to be a nurse, but you can do a lot of things, and it depends on what you would like to do. So that happened to me for the previous 25 or so years. Were so productive that I was able to move from one branch to the other of nursing. So after 9 years of being a dialysis or transplant nurse, when I say transplant, we specialize in kidney transplant at NKI. and also eye transplantation. So I decided to move up to the academe. So I took some masteral units in, and then after that, I became a professor slash clinical instructor at St. Louis University. So by that time, I was already married, and yes, I am also married to a registered nurse who has the same career path as myself. We started in OR, we became professors, and 4 years after being professors, we were invited to work in Alberta, Canada. And initially, we started, as for myself, I started in the OR, but not as a registered nurse, but as an ORT or OR technician. That's how it is. They have differences in, in their requirements. Anyway, moving forward, I was in the OR, and then there was a time when we moved to Prince Edward Island to work as an OR nurse too. And at the same time, I was introduced to another branch of nursing, which is the nursing home. So I got to work also in part-time in a nursing home, at the same time working in an OR. Anyway, moving forward, in 2019, we were also invited to work here in the United States as OR nurses. Then, a few months after that, I was asked to assume a leadership position in the OR. So, ilan na yon? We started as bedside nurses, we moved forward to being OR nurses, even recovery room nurses, and then we became teachers or professors, and then we became nurses in the nursing facility, and also a lot of branches. So again, you can also work in the administration, so I'm now part of that. So what I mean to say is, you just have to move forward. Madaming pwedeng gawin sa nursing. Pwede ka rin maging doktor kung gusto mo. Pwede ka rin mag-specialize sa ICU or mental health. So, ang question, is it fulfilling and are you being paid well? So, of course, kasi gusto ko, decision ko to take care of the well and the sick at the same time. Very practical ang course ng nursing. You can use it at home, you can use it at work, you can use it anywhere. Kapag nurse ka. Understood that if you're a nurse, you're also an educator. You take care of the well. At ibig sabihin, kahit walang sakit, yung estudyante, you take care of the students, you take care of your staff. So it's a very good opportunity for you to just do what you want, do what you love to do. So, of course, ang pinaka-importante doon, does it bring money to your table? Does it feed your family? Yes, it does. And you're very well compensated. Siyempre, depende kung saang state ka magtatrabaho. Diba? Canada has its own benefits. And actually, doon kami we decided to be Canadians. So, Filipino-Canadian kami working in the US. Diba? So, I'm just telling you that there's a lot of opportunities for you to work and to earn. So, walang shortcut. You have to work for it. Sa inyo lang, you have to plan. You have to think about, do you like it? Will it benefit you? Will it benefit your family? Right? Ngayon, masaya ka ba? Kung hindi ka masaya sa pagiging nurse sa bedside, you can move ahead. You can like move forward. Sabihin mo, okay, I want to be an ICU nurse. I want to be an OR nurse. Or, you have a lot of privilege to do that. I mean opportunities to become what you want. The only thing is you have to want it, you have to plan it, and at the same time you have to execute it. So that's it. I hope I got to impart what I wanted to say to you guys, and I just hope that some of you will become nurses too, just like me, and will be able to help, especially now during this time during the pandemic. We're very short of nurses. We do need a lot of nurses, especially in this hospital. In fact, you know what, I have my oldest child, I have two kids, 16 and 8. She actually wants to become a nurse specializing in mental health. And at the same time, because of this pandemic, she realized that a lot of youth, a lot of young people are depressed, and no one knows, like no one knows what's happening. And that's why now she decided to, okay, I'm interested to learn and to be an encouragement to my young people. So she wants to dive in, and she really wants to educate herself, and she wants to do it through nursing. So congratulations again, guys, and I just hope and pray that you'll be able to make it. I know you will. So congratulations again. I'm sorry for that. I'm actually at work right now, and I'll see you later. If you have questions, ask the organizers of this group. If you want to reach out to me, you can ask your questions. You can if you want to talk to me, we can talk through Messenger or through Zoom. That's fine. Okay, just call me Ate Janice. Okay, congratulations and God bless you.
Hello everyone, my name is Jovi Garcia, CCS HSA Batch 82. Woohoo! I'm currently residing here in Fairlawn, New Jersey, and I've been working as a physical therapist for the past 20 years. Today, I'm going to talk about physical therapy as a career. So I hope that by the end of this short presentation, I'll be able to inspire you in joining this fun, exciting, and dynamic world of physical therapy. Okay, and just a little blurb about myself. I'm a graduate of Mercy College, School of Health and Natural Science in Dobbs Ferry, New York. I have a bachelor's degree in health science and doctorate in physical therapy. I've been working as a physical therapist for 20 years. I work particularly in sports medicine, children with cerebral palsy, traumatic brain injuries, skilled nursing facility, hospital acute rehab, and home care physical therapy. The college curriculum would typically require health and natural sciences, particularly biology, chemistry, anatomy and physiology with cadaver, neuroscience, and mathematics, particularly algebra, pre-calculus, statistics, and physics. All these leading to the graduate degree program. And so let's define physical therapy. What is physical therapy? A paraphrase definition from American Physical Therapy Association, even Google. So physical therapy is exercise treatment for patients who suffer from disease, injury, or deformity, causing their function, movement, and flexibility to be impaired. It utilizes physical treatments such as therapeutic exercises, patient education, implementation of assistive devices and modalities, rather than drugs or surgery. So where do physical therapists work? Physical therapists work in early intervention, particularly working with infants and toddlers with developmental milestones delay, such as delay in standing and walking, and overall functional development. In order to engage the child, the physical therapist must be creative enough to engage play so that the child will be interested, but unknowingly also gaining strength and function. Physical therapists also work with children with cerebral palsy. So cerebral palsy is a result of an accident or trauma during childbirth. Similarly, the physical therapist must create creative activities such as play in order for the child to engage. Physical therapists can also introduce assistive devices such as walkers, ankle foot orthosis, so that the child can walk and play. Physical therapists also work with patients who acquired injuries from sports or their occupation or even motor vehicle accident, a car accident, and as a result, loss of ability to work and function. In the sports medicine setting, the physical therapist can also work with patients who had injuries from their leisure activities such as basketball, playing tennis, even rock climbing. So for patients with spinal cord injuries who develop paralysis, physical therapists also develop programs in order to build strength, balance, and teach them how to walk with new devices. So nowadays, the older adults are living longer. So physical therapists work with these patients who develop stroke or who needed joint replacements from arthritis. Physical therapists work with patients with stroke, Parkinson's disease, similarly, in order to improve function, by improving strength and balance and using walking devices, including educating the patient with wellness for overall quality of life. Here in the United States, the majority of the physical therapists, a large number of the majority of physical therapists, find employment working with older adults as well. And some physical therapists also find employment in professional sports, even high school sports, college, and also in professional division. Their job is to rehabilitate the athlete back to their top athletic skills. And for those patients who have difficulty leaving their homes because of their disease, home care physical therapists will be there to help improve strength and balance in order for the patient to function again or be able to go to the outpatient clinical setting. And so those are the typical settings where physical therapists work. And for those of you who may want to work abroad, you may need to work on your master's degree and employment sponsorship. So overall, physical therapy is a career that can be fun, exciting, dynamic, and fulfilling. It can also be financially rewarding because of its stability. I hope that I was able to inspire you to join our team. Again, my name is Joby Garcia from CCS HSA Batch 82. Woohoo! I wish you all the best of luck in your future career and endeavors. Thank you.